Good day, everyone. How are you? By the way, I am Icy Bettaber, your host in the series Health is Wealth. This is our episode about neurodegenerative diseases. Atasha will introduce this to you. Atasha?
Hi, I'm Natasha and I'm going to tell you what is neurodegenerative diseases. Neurodegenerative diseases are conditions that gradually damage and destroy parts of your nervous system, especially areas of your brain. These conditions usually develop slowly and the effects and symptoms tend to appear later in life. Here are some main types of degenerative brain diseases, including dementia-type diseases, demyelinating diseases, Parkinsonism-type diseases, motor neuron diseases, and prion diseases. Dementia-type diseases. These cause progressive damage to various areas of your brain, causing neurons in several areas of your brain to die. Demyelinating diseases. These involve myelin damage or loss, which affects sending and relaying of nerve signals. Motor neuron diseases. These happen when neurons that control movement die off. Prion diseases. These are type of protein misfolding diseases that cause serious brain damage in a relatively short time. Most people don't survive this type of disease for more than a year. Hey Janelle, how common is neurodegenerative diseases?
Thank you, Atasha. So, how common are the degenerative brain disease or neurodegenerative disease? Degenerative brain disease are uncommon but happen often enough to be a common knowledge. Researchers estimate they affect more than 50 million people worldwide. Most of these conditions are strongly connected to age and are much more likely to happen in people over 65. But some conditions like Huntington's disease and ALS often appears earlier. The World Health Organization or WHO projects that the number of people over 65 will at least double in the next 30 years. That means the number of the people with a neurodegenerative condition will also climb at a similar rate. Here are some symptoms of neurodegenerative disease vary widely. Some may have an obvious connection to a degenerative brain disease. Other symptoms might seem completely unconnected without specific medical testing. In general, the different types of condition cause the following symptoms. Demyelinating disease. Common symptoms include the tingling or numbness, pain, muscle spasms, weakness and paralysis, coordination issue and fatigue. Parkinsonism type disease. This often involves showed movements, shaking and tremors, balance problem, shuffling steps and hunches posture. Motor neuron disease. This affects parts of your brain and nervous system responsible for muscle control. As the neurons in those areas die, you lose muscle control that cause weakness and eventually paralysis. How about you, Carl? What are the causes of neurodegenerative disease?
Some neurodegenerative diseases have a single cause that healthcare providers can identify, but in many cases there isn't a single cause. Instead, research shows multiple factors probably contribute to neurodegenerative diseases, and there are times when providers might not be able to find a cause, which can be frustrating for someone with one of these conditions or their loved ones. So far, experts have identified dozens of possible causes or risk factors. These tend to fall into a few specific categories include age. This is generally the most important factor in developing neurodegenerative diseases. These conditions have strong ties to age. The older you are, the greater your chances of developing one. Some degenerative brain diseases can start earlier in life, but this is less common. Genetics. Many neurodegenerative diseases have strong ties to family history. That's often because of specific mutation you can inherit that increase your risk. Spontaneous mutation can also happen, and sometimes a combination of genes plays a role. Environment. Your environment can be a major factor in developing this condition. Exposure to pollution, chemicals and toxins, certain types of infection, and even where you live may all play a role. For example, lower vitamin D levels, which are more common than farther you live from the Earth's equator, have links to dementia type disease. Medical history. Your medical history and past health events can all play a role in developing neurodegenerative diseases. Some neurodegenerative conditions can either happen because of specific medical events or can get worse because of them. Some examples include cancer, certain types of infection, if you had head injuries, and more. Habits, routines, and choices. Example include what you eat, how active you are, whether or not you use tobacco products, how much alcohol you consume, and many more.
How is it diagnosed? Diagnosing a neurodegenerative disease varies depending on the condition you have. Healthcare providers can start with a simple neurological exam by asking your loved ones questions about your symptoms and medical history. Other conditions are diagnosable with specific tests. Some of these include laboratory testing. Blood tests and genetic testing are sometimes all it takes to diagnose a certain neurodegenerative condition. Imaging scans, computed tomography or CT scans, magnetic resonance imaging or MRI scans, and other imaging tests are often very important in diagnosing these conditions. They allow healthcare providers to see your brain and determine if there's a damage or changes that indicate you have a neurodegenerative condition or to rule out other causes. Histopathology or microscopic tissue analysis after death. Some neurodegenerative conditions such as Pick's disease or chronic traumatic encephalopathy are diagnosable while you're alive. Other tests are also possible depending on the condition you have or the symptoms you show. This can vary widely because they depend on what area of your brain they affect. Your healthcare provider is the best person to tell you what tests they recommend in your situation and why. Atasha, what are the treatments?
How are neurodegenerative diseases treated, and is there a cure? Unfortunately, all neurodegenerative diseases are incurable. These diseases destroy brain cells, which is impossible to reverse. Some of these are treatable, depending on why they happened. Some of these conditions are treatable directly, so you may be able to manage, limit, or slow their effects. Other conditions aren't treatable directly, but it might be possible to treat the symptoms and improve your quality of life. Because the treatment can vary so widely. Your healthcare provider is the best person to tell you what treatments are possible and which they recommend. They can also tell you about the side effects and complications you might experience, what to watch for, and any other considerations. Can this be prevented? Neurodegenerative diseases happen unpredictably. Most of them happen for a reason that aren't fully understood, because both those facts aren't preventable. While neurodegenerative diseases aren't preventable, there are things you can do to lower your risk of developing one. Because these diseases are often due to a combination of factors, reducing the number of factors may help lower your risk. These are the steps that you're going to do.
At a balanced diet, your diet affects your brain health, and a poor diet can make your brain more vulnerable to developing a neurodegenerative disorder. It can also make other conditions that could contribute, such as stroke, more likely to happen.
Stay physically active and maintain a healthy weight. Your weight and activity level also affect your brain. Weight-related conditions and concerns, especially circulatory problems like high blood pressure and metabolic conditions like type 2 diabetes, can also contribute.
Wear a safety equipment as needed. Head injuries, especially concussion and traumatic brain injuries, can strongly increase your risk of neurodegenerative disorder. that make safety equipment available to preventing injury and protecting your brain health in the long run. See your primary care provider annually. This can help avoid or delay chronic medical condition that might later contribute to neurodegenerative disease. This visit may also help detect neurodegenerative disease earlier. That's helpful because many of these conditions are much more treatable in their earlier stage.
So, could a short term memory loss a symptom of neurodegenerative disease? Yes, and there's a lot of symptoms that I know that some of you are experiencing it, but depends on the disease. Wow, there's so many type and symptoms of neurodegenerative disease. I hope that you have a new knowledge about our health. Thank you for listening and see you in our next episode.